100 questions plus answers for competency test. Topic: Anesthesiology. 1. What is the main purpose of anesthesia? Answer: to eliminate pain, provide muscle relaxation, and reduce patient awareness to facilitate surgical procedures. 2. What type of anesthesia is used for minor procedures such as wound sutures? Answer: local anesthesia. 3. What is meant by regional anesthesia? Answer: anesthesia administered to specific nerves or plexuses to numb a certain area of the body. 4. What is an example of epidural anesthesia? Answer: anesthesia given in the epidural space for procedures such as childbirth or pelvic surgery. 5. What is the difference between spinal and epidural anesthesia? Answer: spinal anesthesia is injected into cerebrospinal fluid in the subarachnoid space, while epidural is given in the epidural space without penetrating the dura mater. 6. What is general anesthesia? Answer: anesthesia that induces complete loss of consciousness for major surgical procedures. 7. What is rapid sequence induction, RSI? Answer: a fast anesthesia induction technique to prevent aspiration, commonly used for patients at risk of regurgitation. 8. What are the main complications of general anesthesia? Answer: respiratory depression, hypotension, and risk of aspiration. 9. What are the side effects of spinal anesthesia? Answer: post-lumbar puncture headache, hypotension, and urinary retention. 10. What are the most commonly used inhalation anesthetic agents? Answer: isoflurane, sevoflurane, and desflurane. 11. What is the purpose of premedication before anesthesia? Answer: to reduce anxiety, prevent excessive airway secretions, and minimize stress responses. 12. What is an absolute contraindication for spinal anesthesia? Answer: infection at the injection site, coagulopathy, and severe hypotension. 13. What is meant by MAC, minimum alveolar concentration? Answer: the concentration of inhalation anesthetic in the alveoli that prevents motor response in 50% of patients to painful stimuli. 14. What is the function of neuromuscular blockers in general anesthesia? Answer: to provide muscle relaxation for intubation and surgery. 15. What is the difference between ester and amide local anesthetics? Answer: esters, e.g., procaine, are metabolized in plasma, while amides, e.g., lidocaine, are metabolized in the liver. 16. What are the main complications of epidural anesthesia? Answer: hypotension, bradycardia, and dural puncture. 17. What is the primary indication for ketamine anesthesia? Answer: procedures with a risk of hypotension or for patients with unstable hemodynamics. 18. What are the main side effects of ketamine? Answer: hallucinations, nightmares, and increased intracranial pressure. 19. What type of anesthesia is best for cataract surgery? Answer: local anesthesia or retrobulbar block. 20. What is an absolute contraindication for general anesthesia? Answer: patients with a history of malignant hyperthermia or allergies to certain anesthetic agents. 21. What is meant by conscious sedation? Answer: a mild sedation state where the patient remains responsive but relaxed during the procedure. 22. What are common complications of inhalation anesthesia? Answer: hypotension, tachycardia, and respiratory depression. 23. What is mechanical ventilation during general anesthesia? Answer: respiratory support using a ventilator to ensure oxygenation and carbon dioxide elimination. 24. What are the most commonly used intravenous induction agents? Answer: propofol, etomidate, and thiopental. 25. What are the advantages of propofol over other anesthetic agents? Answer: rapid onset, quick recovery, and lower risk of nausea and vomiting. 26. What are contraindications for succinylcholine use? Answer: hyperkalemia, history of malignant hyperthermia, and extensive soft tissue trauma. 27. What is the primary cause of malignant hyperthermia? Answer: a genetic reaction to inhalation anesthetics or succinylcholine. 28. What are early signs of malignant hyperthermia? Answer: increased end-tidal CO2, EtCO2, tachycardia, and muscle rigidity. 29. What is the main treatment for malignant hyperthermia? Answer: administration of dantrolene, cessation of triggering agents, and body cooling. 30. What is the goal of intraoperative anesthetic monitoring? Answer: to ensure patient safety by monitoring vital signs, oxygenation, and depth of anesthesia. 31. What is the ASA physical status classification? Answer: a system for classifying the health status of patients prior to anesthesia and surgery. 32. What are signs of local anesthetic overdose? Answer: headache, dizziness, tinnitus, seizures, and cardiovascular depression. 33. Which local anesthetic is safe for use in pregnant women? Answer: lidocaine. 34. What is meant by regional anesthesia blockade? Answer: a technique to block pain in a specific body area, such as nerve blocks or plexus blocks. 35. What are the benefits of regional anesthesia compared to general anesthesia? Answer: lower risk of complications, faster recovery, and fewer systemic effects. 36. What are complications of general anesthesia in obese patients? Answer: difficult intubation, hypoventilation, and postoperative apnea. 37. What is the primary indication for inhalation anesthesia in children? Answer: more comfortable induction compared to intravenous routes. 38. What is multimodal analgesia? Answer: an approach using multiple drug classes to control pain, reducing opioid use. 39. Which inhalation anesthetic is safest for patients with heart disease? Answer: sevoflurane. 40. What are complications of local anesthesia in peripheral nerves? Answer: nerve injury, hematoma, and infection. 41. What are contraindications for nerve block anesthesia? Answer: local infection, coagulation disorders, and allergies to anesthetic agents. 42. What is the reversal agent for neuromuscular blockade? Answer: neostigmine or sagamidex. 43. What is the purpose of opioid use in anesthesia? Answer: to control intraoperative and postoperative pain. 44. What are the risks of opioid use in anesthesia? Answer: respiratory depression, nausea, vomiting, and drug tolerance. 45. What is the primary goal of positive pressure ventilation? Answer: to ensure adequate oxygenation and ventilation during general anesthesia. 46. What is awake fiber optic intubation? Answer: a technique for tracheal intubation in awake patients, often used in difficult airway cases. 47. What are the signs of an allergic reaction to anesthesia? Answer: urticaria, edema, hypotension, and anaphylaxis. 48. What are the main steps in managing a difficult airway? Answer: use of video laryngoscopy, mask ventilation, or emergency crocothyroidotomy. 49. What is the primary purpose of EtCO2 monitoring during anesthesia? Answer: to ensure adequate ventilation and early detection of hypoventilation. 50. What are the benefits of using nitrous oxide in anesthesia? Answer: rapid onset, additional analgesic effect, and reduced doses of other inhalation anesthetics. 51. What is the function of BIS, bispectral index, in anesthesia? Answer: to monitor the depth of anesthesia by measuring brainwave activity. 52. What is the main indication for TIVA, total intravenous anesthesia? Answer: patients with a risk of postoperative nausea and vomiting or allergies to inhalation agents. 53. What does the triple airway maneuver mean? Answer: an airway opening technique involving head extension, jaw elevation, and mouth opening. 54. What are the main complications of local anesthesia in brachial plexus block? Answer: nerve injury, pneumothorax, and hematoma. 55. What is meant by emergency crocothyrotomy? Answer: a surgical emergency procedure to open the airway through the cricothyroid membrane. 56. What are the side effects of local anesthesia with adrenaline? Answer: tachycardia, hypertension, and excessive vasoconstriction. 57. What is the purpose of giving atropine before induction of anesthesia? Answer: to reduce airway secretions and prevent bradycardia. 58. What does laryngospasm mean? Answer: sudden contraction of the vocal cords causing airway obstruction. 59. What is the main action to manage laryngospasm? Answer: providing positive pressure with 100% oxygen and, if necessary, administering succinylcholine. 60. What anesthetic agent is commonly used for patients with a history of asthma? Answer: propofol and sevoflurane due to their bronchodilatory effects. 61. What are the clinical signs of airway obstruction during anesthesia? Answer: oxygen desaturation, abnormal breath sounds, and chest retractions. 62. What does train of 4, TOF, mean? Answer: a nerve stimulation method to evaluate the degree of neuromuscular blockade. 63. What is the main indication for epidural anesthesia in obstetric patients? Answer: pain management during labor and anesthesia for cesarean delivery. 64. What are the main side effects of nitrous oxide anesthesia? Answer: diffusion hypoxia, nausea, and vomiting. 65. What complications can occur in patients with prolonged mechanical ventilation? Answer: barotrauma, atelectasis, and respiratory tract infections. 66. What is meant by perioperative hypotension? Answer: a drop in blood pressure occurring during or after surgery. 67. What is the management for intraoperative hypotension? Answer: administration of intravenous fluids, vasopressors, or inotropic agents. 68. What is the purpose of oxygen saturation monitoring with pulse oximetry? Answer: to ensure adequate tissue oxygenation during anesthesia. 69. What does combined anesthesia mean? Answer: a combination of 2 or more types of anesthesia, such as general and regional anesthesia. 70. What are the main complications of endotracheal intubation? Answer: airway trauma, perforation, and laryngeal spasm. 71. What is the primary step in managing anesthesia in patients with hypovolemic shock? Answer: restoring fluid volume before anesthesia induction. 72. What is the main indication for sedation in the ICU? Answer: to ensure patient comfort, reduce stress, and facilitate mechanical ventilation. 73. What are the most commonly used sedative agents in the ICU? Answer: propofol, midazolam, and dexmedetomidine. 74. What are the signs of bronchospasm during anesthesia? Answer: increased airway pressure, wheezing, and oxygen desaturation. 75. What is the main management for intraoperative bronchospasm? Answer. Administration of bronchodilators such as salbutamol or epinephrine. 76. What is the purpose of fentanyl use in anesthesia? Answer. To control intraoperative pain and provide additional analgesic effects. 77. What are the main complications of inhalation anesthesia in patients with a history of COPD? Answer. CO2 retention and risk of pneumothorax. 78. What is the benefit of intravenous lidocaine in anesthesia? Answer. Reducing pain, preventing arrhythmias, and speeding up postoperative recovery. 79. What is pincuronium bromide? Answer. A non-depolarizing neuromuscular blocker agent used in anesthesia. 80. What are the main side effects of pincuronium? Answer. Tachycardia and hypertension. 81. What is the role of corticosteroids in anesthesia? Answer. Reducing inflammation and preventing nausea and vomiting postoperatively. 82. What is the main risk of spinal anesthesia in patients with spinal stenosis? Answer. Nerve injury or worsening neurological symptoms. 83. What is the main indication for MAC, monitored anesthesia care? Answer. Minor procedures with minimal sedation requirements, such as biopsies or endoscopy. 84. What are the signs of opioid overdose during anesthesia? Answer. Respiratory depression, bradycardia, and decreased consciousness. 85. What is the purpose of Sagamidex in anesthesia? Answer. To reverse the effects of neuromuscular blockade from rocuronium or vecuronium. 86. What is the main step to avoid aspiration during general anesthesia? Answer. Rapid sequence induction, RSI, and preoperative fasting. 87. What are the main side effects of propofol? Answer. Hypotension, bradycardia, and pain at the injection site. 88. What does awake craniotomy mean? Answer. A brain surgery procedure where the patient remains awake to assist in brain function mapping. 89. What are the risks of anesthesia in patients with liver dysfunction? Answer. Reduced drug metabolism and increased bleeding risk. 90. What are the early signs of air embolism during anesthesia? Answer. Hypotension, oxygen desaturation, and a characteristic heart murmur. 91. What is the main action to manage air embolism? Answer. Left Trendelenburg position and aspiration of air through a central venous catheter. 92. What are the risks of spinal anesthesia in obese patients? Answer. Difficult technique, inadequate anesthetic dosing, and hypotension. 93. What is the main purpose of dexmedetomidine in anesthesia? Answer. Light sedation with minimal respiratory depression. 94. What are the signs of pneumothorax during anesthesia? Answer: oxygen desaturation, hypotension, and tracheal deviation. 95. What anesthetic agents can cause hypothermia? Answer: propofol and inhalation agents like sevoflurane. 96. What is the purpose of epinephrine administration in patients with anaphylaxis during anesthesia? Answer: to increase blood pressure and dilate the bronchi. 97. What is the main indication for intercostal nerve block? Answer: post-thoracotomy pain or chest trauma. 98. What are the risks of anesthesia in elderly patients? Answer: increased sensitivity to anesthetic agents, hypotension, and decreased organ function. 99. What does ASA-V mean in the ASA classification? Answer: a patient who is not expected to survive without emergency surgery. 100. What is the main purpose of invasive blood pressure monitoring during anesthesia? Answer: real-time blood pressure monitoring during high-risk procedures.